Have you ever felt tired all the time, even after a full night of sleep, and just brushed it off as stress or getting older? That quiet, constant fatigue might actually be your heart asking for help. And before we go deeper, if this kind of hidden health insight matters to you, gently tap like so more people can discover it too. In heart failure, the heart cannot pump blood efficiently enough to meet the body's needs. According to the American Heart Association, reduced cardiac output means less oxygen and nutrients are delivered to muscles and tissues. This forces your body to operate in a low energy state, almost like your internal battery never fully charges. You are not lazy, and you are not just tired. Your body is literally underpowered. What makes this tricky is how subtle it feels. Many people describe it as just feeling off, or getting tired more easily than before. You might notice that climbing stairs feels harder, or that daily tasks that used to be effortless now require breaks. One study published in Circulation found that fatigue is among the earliest and most commonly overlooked symptoms of heart failure, especially in women. The aha moment here is this: fatigue from heart failure does not improve much with rest. It is persistent, disproportionate, and slowly progressive. So if your tiredness feels deeper than usual and does not match your lifestyle, it might be time to listen more closely. Have you ever noticed yourself getting out of breath faster than usual? Maybe while climbing stairs or even just walking at a normal pace, and thought, maybe I just need to exercise more? That assumption is incredibly common and sometimes dangerously misleading. In heart failure, shortness of breath happens because fluid begins to build up in the lungs, a condition known as pulmonary congestion. The heart is not pumping effectively, so blood backs up into the lungs, making it harder for oxygen to move into the bloodstream. According to the American College of Cardiology, up to 90% of patients with heart failure experience some form of breathlessness, making it one of the most hallmark symptoms. What makes this sign especially important is how it evolves. At first, you may only feel breathless during exertion. Then, it can progress to happening during simple activities like talking or walking short distances. Eventually, some people notice they cannot lie flat without feeling like they are suffocating, a symptom called orthopnea. They may start sleeping with extra pillows without even realizing why. Here is the aha moment. Being out of shape improves with activity over time, but heart-related breathlessness tends to worsen. If your breathing feels harder despite normal or even reduced activity levels, your body may not be deconditioned. It may be struggling. Have you ever noticed your shoes feeling tighter at the end of the day, or your socks leaving deeper marks on your skin, and thought it was just from standing too long? This small, almost harmless detail can actually be one of the clearest physical signs that your heart is under strain. In heart failure, the heart cannot pump blood forward efficiently, so blood begins to back up in the veins. This increases pressure in the blood vessels and pushes fluid out into surrounding tissues, especially in gravity-dependent areas like the legs, ankles, and feet. This condition is called peripheral edema. According to clinical data from the European Society of Cardiology, fluid retention is present in a large proportion of heart failure patients, and is often one of the first visible signs. What makes this symptom deceptive is how gradual it can be. The swelling may start mild and painless. You might only notice it in the evening and see it disappear by morning, which makes it easy to dismiss. But over time, it can become persistent, spread upward, or even involve the abdomen. Here is the aha moment. Not all swelling is equal. If your swelling is symmetrical, leaves an indentation when pressed, and keeps coming back, it is not just about standing or salt intake. It may be your circulation system quietly struggling. Have you ever stepped on the scale and noticed your weight jump up by 1 or 2 kilograms in just a few days, even though your eating habits have not changed? That can feel confusing, even frustrating. But in some cases, it is not fat gain at all. It is fluid, silently building up inside your body. And before we go deeper, if you have ever been surprised by unexplained weight changes, leave a comment below and share your experience so others know they are not alone. The body starts retaining sodium and water because the kidneys receive less blood flow. This triggers hormonal responses that make your body hold on to fluid as a survival mechanism. According to the American Heart Association, rapid weight gain of about 2 to 3 pounds in a day or 5 pounds in a week can be an early warning sign of worsening heart failure. What makes this sign powerful is that it shows up before you can clearly see swelling. The scale often detects changes earlier than the mirror. You might not feel dramatically different yet, but your body is already shifting internally. Here is the aha moment. Weight gain from fat takes time, but weight gain from fluid is fast, quiet, and reversible if caught early. So if your weight increases suddenly without a clear reason, it is not something to ignore. It is something to investigate. Have you ever had a cough that just would not go away, especially at night, and assumed it was a lingering cold or maybe a bit of throat irritation? Sometimes that cough is not coming from your throat at all. It is coming from your heart. In heart failure, fluid can accumulate in the lungs, irritating the airways and triggering a chronic cough. This is often referred to as cardiac cough. According to clinical observations reported in cardiology guidelines, many patients with heart failure experience a dry cough or a cough that produces white or pink frothy mucus, especially when lying down. This happens because fluid shifts more easily into the lungs in a horizontal position. What makes this symptom easy to miss is how similar it feels to common respiratory issues. You might treat it with cough syrups or assume it is due to allergies. But unlike a typical cough, this one tends to worsen at night, may wake you from sleep, and often comes with a subtle feeling of breathlessness. Here is the aha moment. A cough that changes with body position, especially one that worsens when you lie flat and improves when you sit up, is not just a lung issue. It can be a signal that your heart and lungs are struggling to stay in balance. Have you ever felt your heart suddenly start pounding, fluttering, or skipping beats for no clear reason, and then just tried to ignore it? Those moments can feel unsettling, but many people dismiss them as stress or caffeine. Sometimes, though, it is your heart trying to compensate for something deeper. In heart failure, the heart often tries to make up for its reduced pumping ability by beating faster or changing its rhythm. This can lead to palpitations or arrhythmias. According to research published by the Heart Rhythm Society, irregular heart rhythms, such as atrial fibrillation, are very common in people with heart failure and can further reduce the heart's efficiency. What makes this symptom important is that it is both a sign and a risk. A faster heart rate might temporarily help circulate blood, but over time it puts extra strain on an already weakened heart. You might feel a racing sensation in your chest, a fluttering feeling, or even brief pauses that make you catch your breath. Here is the aha moment. Not all palpitations are harmless. If your heartbeat feels irregular, happens frequently, or comes with dizziness or shortness of breath, it is not just a moment of anxiety. It may be your heart signaling that it is under pressure and needs attention. Have you ever walked into a room and forgotten why you were there? Or felt lightheaded when standing up, and just laughed it off as being busy or distracted? These small mental lapses can feel harmless, but sometimes they reflect something deeper happening in your body. In heart failure, the brain may not receive enough oxygen-rich blood due to reduced cardiac output. According to research published in the Journal of the American College of Cardiology, cognitive impairment and reduced concentration are surprisingly common in patients with heart failure, especially as the condition progresses. When blood flow to the brain is slightly compromised, even subtly, it can affect memory, attention, and clarity. What makes this symptom easy to overlook is how normal it feels in modern life. Stress, lack of sleep, and multitasking can all cause similar effects. But when brain fog appears alongside physical symptoms like fatigue or shortness of breath, it paints a more complete picture. Here is the aha moment. Your brain is one of the most sensitive organs to changes in blood flow. Even a small drop can affect how clearly you think and how steady you feel. So if you notice frequent dizziness, trouble concentrating, or moments of confusion that feel new or unusual, it may not just be mental overload. It may be a circulation issue. Have you ever found yourself waking up multiple times at night to go to the bathroom, even though you did not drink much before bed? It might seem like a normal part of aging, or just a light sleep pattern, but it can actually be one of the earliest and most overlooked signs of heart failure. And before we wrap this up, if you have learned something new today, gently tap subscribe so you can stay connected with more simple ways to protect your heart. During the day, when you are standing or sitting, fluid tends to accumulate in your lower body due to gravity. But when you lie down at night, that fluid redistributes back into your bloodstream. This increases blood flow to the kidneys, prompting them to produce more urine. According to clinical observations, this symptom, called nocturia, is commonly reported in early stages of heart failure. What makes this sign so subtle is that it does not feel alarming. You might simply think you are drinking too much water or having lighter sleep. But when it happens consistently and is combined with other symptoms like swelling or fatigue, it becomes much more meaningful. Here is the aha moment. Your body often reveals problems during rest, not activity. If your nights are becoming more interrupted by urination without a clear reason, it may be your circulation system quietly shifting and asking for attention.